I want to really emphasize in Taut band therapy the key component of assessment. I have a very simple motto, and that is if you're smart enough to figure out exactly what the problem is, the chances of fixing it go way up. That's true for a lot of things, of course, but massage therapists are relatively inclined to just get right in there and start feeling their way through it. And I believe that's fine. Your fingers are the most talented tools in all of medicine. But if you take the time ahead of time with your patient and talk to them and do an interview and get them to demonstrate ranges of motion, and you can come up with maybe not an absolute diagnosis. We don't diagnose, we assess. But if you come up with your best working theory about what muscle in particular, or maybe two muscles, what really is causing the pain, oftentimes you'll find in an area there'll be several muscles that are tight, but you would generally find one or two that are causing the pain. Those, of course, are the ones that you want to isolate and identify, and to focus your treatment on those particular muscles. And you're not just looking for a particular muscle. Most of the time, in many muscles anyway, you're looking for that streak of tension within the muscle. So you want to take the time to identify the muscle, and then to identify where the trigger point is, and then to identify where the taut band is going. That taut band is important because at one end you'll find a sensitive or sore attachment. At the other end you'll find a sensitive or sore attachment site. In the middle somewhere you'll find the trigger point itself. But the assessment is really important. Taut band therapy ideally is strategic. You want to identify and treat a particular muscle and to see what that does. If that solves the problem, then you can go on to do some general massage. But we need to wear the hat of a detective, and don't be afraid of that. We need to use logic. We need to use our intelligence to isolate and to identify the problem. And that doesn't just stop in the beginning. Your assessment begins the session, it continues throughout the session, and a good assessment at the end is also useful. You're looking for measurable achievements. Say Mrs. Jones comes in with some kind of problem with her shoulder and she can only raise it to here. Well, if you can verify that in the beginning, and then at the end of the session you can say, whoa, Mrs. Jones can have this range of motion, then you've got something that you can report back to her healthcare provider that it went from one range of motion to another range of motion. Assessment is key throughout the process. And you don't always get it right the first time. I don't get it right all the time. But we're looking for evidence to support that assessment. And if you find it, go ahead and continue. But if you find evidence that that isn't the right muscle, well, you've got to be prepared to throw out that assessment and to come up with a new working theory. The reason it is important is because it makes your work easier. It makes your work more effective. That's of course good for your patient, but it is also good for you. You're not having to work as hard. I hear way too frequently about good practitioners doing trigger point work, and they're just pressing and pressing and pressing and pressing. Sometimes, in my opinion, too hard. You need to be within that patient's threshold so as to not provoke. But pressure is good, but it is not the only or the most important factor. You want to be using the range of motion in a joint in the movement of a joint to assist in the lengthening process. And that is really an important way to go beyond just pressing all the time. And this is my own personal experience, that it is the movement at the joint and the movement in general that has enabled me to go beyond just using pressure. And there is a limit to how much pressure you can use. But when you're using movement, when you're using traction, when you're using other tools in combination with pressure, your efficacy increases, but also it's easier on you. You don't have to rely just on the pressure. It's easier on your body. It's better and more effective for your patient. That's a pretty good combination.